to public service. She has an extensive career in government and has always been committed to public service. She's worked in the Florida legislature for 13 years. She was elected to the Florida House of Representatives in 2016 and then re-elected unopposed in both 2018 and 2020, representing the 45th district, which includes West Orange County. Today, Representative Brown is the House Democratic Leader pro tempore and Vice Chair of the Florida Legislative Black Caucus. She currently serves on the Healthcare Appropriations Subcommittee as a Democratic ranking member, the Commerce Committee, the Insurance and Banking Subcommittee, the Rules Committee, and the Tourism, Infrastructure, and Energy Subcommittee. Representative Brown is also an active member in the Central Florida Urban League Young Professionals. We love the Urban League Young Professionals, Orange County League of Women's Voters, and the Junior League of Greater Orlando, where she serves as the Public Affairs Committee. She has been instrumental in drafting and implementing key legislative policies and representing communities from the Jacksonville to the Orlando to South Florida area. What is so important to us in the midst of all the service is her sponsorship of House Bill 645, a bill recently signed by our governor, extending Medicaid coverage to pregnant women until 1 year after they deliver their babies. We are so honored, so excited to welcome Representative Camilla Brown. Thank you so much for your dedication, your service, and your genuine commitment to our community. Representative Brown.
Good morning, everyone. And thank you so much for having me here today to be a part of your Healthy Start Coalition of Pinellas virtual meeting. It's an honor and privilege to be here and also to be able to say to you all that Florida has finally extended postpartum Medicaid benefits from 60 days to 1 full year. We here in the United States are experiencing an ongoing maternal health crisis. Maternal and infant mortality is higher within Black, Indigenous, and people of color communities. And these disparities have been exacerbated by COVID-19. Structural, legal, geographic, political, and economic barriers to quality prenatal and postpartum care disproportionately affects those minority communities, but also our rural communities, incarcerated people, people with disabilities, people with substance use disorders, people lacking access to care due to immigration status or lack of healthcare insurance, and people with perinatal mental health care needs. These outcomes have also affected me personally. Disparities in the maternal health equality results in Black mothers in Florida being 3 to 4 times more likely to die from pregnant-related causes. In 2018, Black women here in Florida experienced pregnancy-related mortality at a rate of nearly 3 times that of white women, with 32 deaths per 100,000 live births as compared to 12.9 deaths per 100,000 births, respectively, according to a report that we actually have there at the Department of Health. After advocating for this measure and many others over the years, I was finally able to secure $242 million within the 2021 budget for postpartum care and Medicaid extension. Thanks to the postpartum Medicaid extension, that money is estimated to benefit 97,000 women here in Florida from that extension. A majority of our births here in Florida are, their moms are on Medicaid. Uh, because we never do anything alone, I want to definitely thank Speaker Sprouse, who, definitely helped big time with this issue. As a Democrat in the Florida House, it is a true lift, a heavy lift to do something this significant. He showed his support every step of the way. We met early on, and he championed this issue from the very beginning. I believe he's actually from your area, from that Bay Area. Months prior to the session, he had mentioned that he wanted to do something to address the disparities that women, and particularly Black women, face in maternal health care. He was committed to ensuring that every baby was born healthy and that every new mom experienced improved health outcomes. And that's when I told him, well, I have the bill. I have I have the solution, or part of the solution, to this problem. And I went to him with an array of ideas. And it was this particular idea that he said, Camilla, let's do it. And so I will definitely say he never wavered on his support. And, we stayed in contact every step of the way to figure out how we were going to pay for it, because that was the first thing. You tell me how we can pay for it, and let's do it. From there, the entire House of Representatives sort of put their support behind the issue. And ultimately, during the final budget negotiations, and with help from you guys, the Healthy Start Coalition, and many healthcare stakeholders, the Senate finally came to our position, and we were able to pass it unanimously out of both chambers. And so as of today, that bill has actually been signed by the governor. And so very grateful for that. This measure is just one of the remedies that we know that will go leaps and bounds in ensuring that the lives and well-beings of our moms and our babies are prioritized, and that the maternal morbidity and mortality rates here in Florida will decrease significantly. So again, I want to thank you for allowing me to be here and be a part of your meeting today, and know that I am committed to this work and look forward to our future collaborations and good work that we will do in this space. And again, thank you.
I want to say thank you, Representative, not only for this work, but for your own personal story. I believe that we are storied beings. And when we connect to something personally, it allows our persistence and our commitment to doing the big work, the hard work, remains true. So on behalf of all of us here at the Healthy Start Coalition of Pinellas County and the families that we serve, we're thankful for your leadership in supporting House Bill 645. This bill will ensure that women have the courage and the coverage that they need to be healthy and take care of themselves and their family. Healthy Start Coalition, coalitions across the state will work with women enrolled in Medicaid to ensure that they know they have the coverage for this extended period, and will help them to access the care that they need to keep themselves and their infants healthy. It's one thing to have a bill passed, but implementation is something totally different. And just know that behind you, Representative, you have a full coalition of people who are going to make sure our families have access to the support that they need. Thank you so much. I would now like to introduce our guest speakers, Eliza Lammers, winner of the C-SPAN Award for Decreasing Maternal Mortality in the USA. She is joined by her mother, Erin Lammers, who will share her postpartum story. Eliza is in is in the 7th grade at Charles Rush Middle School in Land O'Lakes. She first learned about maternal mortality from conversations with her mother and other medical professionals. The C-SPAN competition allows students from all over the country to create documentaries on a variety of issues. Lammers created a documentary on maternal mortality. We're going to watch her video and then hear from her mother, Erin. So we're so excited. Eliza, thank you so much for finding interest in this and then digging deep with your mom. We'll now see your video.
In October of 2011, Lauren Bloomstein, a 33-year-old neonatal nurse from New Jersey, gave birth to her daughter, Haley Ann, with barely any trouble. Everyone believed that everything had gone exactly right. As a nurse, Lauren deeply trusted her medical team. When Lauren developed a stabbing pain in her upper abdomen, they boosted her painkillers and the pain stopped. She was finally a mother, and as her husband Larry, a doctor himself, reports, she was happier and more alive than ever before. Less than 24 hours later, however, Lauren died from preeclampsia, a blood pressure disorder. According to the CDC, 3 in 5 maternal deaths in America are preventable. And death can happen up to a year after delivery. This is definitely a problem that needs to be fixed in the U.S.
In terms of maternal health, as you've heard, the United States suffers from an alarming rate of maternal mortality. 700 to 900 American moms die every year. More than any other developed nation, women in the United States stand the risk of death during their pregnancies and childbirth. America is the only developed nation where the rates of women dying during childbirth is 26.7 mothers per 100,000 births and is rising.
Look at the U.S. rates versus other developed countries. Why are our rates rising while other similar countries like Canada are falling? Recently, I spoke to Dr. Cecilia Jevitt, who is currently the Director of Midwifery at the University of British Columbia in Canada. Dr. Jevitt is unique because she also taught for over 35 years in the U.S. at schools like Yale and the University of South Florida.
I think there are 3 key factors to the better health in Canada: strong social support, strong public health, and healthcare that's available to all of its citizens. When I say strong social support, Canada has strong unemployment networks and strong housing networks so that citizens are less likely to be stressed by temporary unemployment. Public health in Canada is funded through a strong Ministry of Health, and Canadians have the expectation that they will have health care when it's needed. They don't worry about the cost.
As it stands today, it is more dangerous to give birth in America than it was 2 decades ago. According to the Centers for Disease Control, the rate of maternal mortality has increased nearly 26% from the year 2000 to 2014. This means that for all women today, they are more at risk of dying when giving birth than their mothers are. And the statistics are even more alarming for women of color. African American women are 3 to 4 times more likely to experience pregnancy-related deaths than Caucasian women.
I also spoke to Dr. Jessica Brumley, the current Vice President of the American College of Nurse Midwives, a practicing midwife, a university professor, and an expert on disparities in prenatal care for people of color.
The way our system was developed here in the United States goes in line with the history of our country, and the people that have been most valued had better access to care, and the system was designed for them, right? So, when our country was formed, women and people of African descent weren't even considered citizens at that time, right?
Yeah,
and so
like property.
So then exactly, right? And so they weren't valued as human beings. And then all of our systems, including our healthcare system, was really designed by and for the people that we valued at that time. And even though some of our laws have changed along the way, I think it still shows. I think it still shows in our healthcare system and the way it's been set up.
Women of color sometimes have their health problems ignored, which can cause them to become deadly. Two good examples of this are Serena Williams and Beyonce. Look at them, both women with good income, and they both had prenatal care, but Serena had a blood clot in her lungs and Beyonce suffered preeclampsia. Both could have been deadly, and both almost certainly could have been prevented.
I learned that Black women are nearly 4 times more likely to die from childbirth than white mothers are in the United States, and that we suffer severe complications twice as often. The data was teaching me that risk is equally shared by all Black women, regardless of income, education, or geographical location.
I've seen many things blamed for poor maternal health, including eclampsia, women who delay prenatal care, they start it late, obesity, poor eating. All of these reasons fall under the umbrella of racism or classism. That is, some women are systematically disadvantaged in all of the areas that support health. Health is a product of many factors, including a nutritious food supply, a clean environment, clean air, safe housing, and jobs that provide enough income to afford nutritious food and safe housing.
But pregnancy-related deaths can happen to anyone. I should know. My own mother nearly died of postpartum preeclampsia 5 days after my twin sister and I were born. But what can I do to lower the rate?
Making sure that we keep attention on this issue. We can't let it be forgotten.
Please implement changes to our healthcare system to improve maternal health in America.
I want to say thank you so much, Eliza, for your advocacy and support of mothers, children, and families. Thank you so much for your commitment and your dedication to this project. We want to now hear from your mom. Who has something to say?
Excuse me. I was thinking my mom would speak in the middle of my talk.
Okay, go ahead.
Okay. Good morning. I'm Eliza Lammers. I'm 13 years old, and I'm so glad to be here speaking. I will be speaking on the making of my documentary, Decreasing Maternal Mortality in the USA, and how my generation will be affected by the decline of the rate. My documentary received a national third prize in C-SPAN Student King competition last winter. It didn't actually take much longer than a 10-minute car ride home from school in September to decide on the topic of my video. Maternal mortality is not only an important issue, but also a part of my life. I knew a little bit about my birth story, but I didn't know how close my mother came to dying. I didn't realize how much of a problem maternal mortality is. If it could affect my life and birth, surely it has and will affect many others. I started my research online through C-SPAN and the CDC website. I found so many stories of perfectly healthy women dying during and after childbirth. I couldn't believe this was still happening in the United States in modern times. Per the WHO, maternal mortality worldwide is down 38% from 2000 to 2017. However, the US rate has increased to 17.4 deaths per 100,000 live births. The rate is even worse among older women and especially among Black women. In a recent CDC study, the maternal death rate for Black women was more than double that of white women. 37.1 deaths per 100,000 live births compared to 14.7. It was also more than 3 times the rate for Hispanic women. Why are these rates increasing when we have more advanced technology than ever before? I spoke to my mother, who suggested that I speak to women in the medical field. She put me in contact with Dr. Cecilia Jevitt, the midwife who delivered my little brother. Dr. Jevitt had worked at the University of South Florida, but left to run the midwifery department at Yale University. She has since taken a post at the University of British Columbia in Canada. Reaching out to Dr. Cecilia Jevitt was maybe the most interesting conversation I've ever had in my life. Not only did she answer my questions very helpfully, but she also invited me to discuss maternal health over a Zoom meeting. It was awesome to listen to a professional, and we talked about many things relating to the subject. And since she lives and works in Canada, she has a different perspective and knows what Canada, which has a much lower maternal mortality rate, even at its worst, does to lower the rate. You saw pieces of my interview with her in my video, but Dr. Jevitt spent hours helping educate me on the topic. It is women like her that will help change the downward trend in the maternal mortality rate. Dr. Jevitt helped me understand that although the United States is one of the most developed and one of the wealthiest countries in the world, not everybody shares in the benefits of that development. Almost half the women in the US don't have health insurance that provide prenatal care. Some women are systematically disadvantaged in areas that support health. Fewer prenatal care providers serve low-income neighborhoods. Black and Hispanic women and recent immigrants may have their problems ignored during prenatal care. A problem ignored can become life-threatening. Dr. Jevitt introduced me to Dr. Jessica Brumley, who is a local midwife here in Tampa Bay, but she is also the vice president of the American College of Nurse Midwives, as well as the Women of Color. Dr. Jessica Brumley had much knowledge on racial disparities in maternal health and many solutions to the ever-growing problem, such as having more women of color in midwifery, which women of color giving birth would much appreciate. She also suggested that hospitals should be closer to the people who need them, particularly in low-income areas. That way, maternal emergencies can be attended to quicker. She suggested national healthcare reform. She said that doctors get paid more to take out gallstones than they do to deliver a live birth. I couldn't believe that a gallbladder is worth more to the US than a mother and a baby. Dr. Brumley gave me so much more than I ever could have read. She was wonderful. But as you saw in my video, this issue is not only important in the world, but in my personal life. In fact, it was the first topic I considered. Why? 5 days after my twin sister and I were born, my mother contracted postpartum preeclampsia that nearly turned into fatal eclampsia. Here she is to tell us more.
Good morning, everyone. Isn't my Eliza wonderful? Like she said, maternal health is a cause near and dear to our hearts. As about a week after I delivered my twins, I nearly died of fatal symptoms. I started to struggle to breathe, and by the time we made it back to the hospital, my lungs were full of fluid, and I nearly had eclampsia. Unlike the dramatic end of my pregnancy, the beginning of my pregnancy was very normal. At 24, I found out I was pregnant with twins at my first ultrasound. My husband and I had been married just over a year, and we were surprised but ecstatic. I never even imagined having twins, and I couldn't believe it was happening to me. Although twin pregnancies are always exceptional, mine was fairly mundane. I had very little complications, aside from the physics of carrying 2 full-term babies inside my 5'3" frame. At 36 weeks, my girls were still transverse, meaning they were positioned sideways inside of me. And so my doctors determined I needed a scheduled C-section. However, I was young and healthy and relatively free of complications, so they decided to let me go as long as possible. We scheduled the surgery for 2 weeks later, and the surgery went off without a hitch. I had 2 7-pound, 38-week beautiful baby girls, truly a triumph in twin pregnancies. A couple days later, my husband and I proudly took our new baby girls home from the hospital. My blood pressure had been a little erratic after delivery, but it was fine whenever I laid down. The hospital and the wonderful doctors did a battery of tests because first-time mothers, especially those pregnant with multiples, have higher rates of complications. At this point, I had no other symptoms of preeclampsia, and so I was sent home with a small blood pressure pill and instructions to go see my doctor in a few days for follow-up. However, on day 5 postpartum, I woke up with a horrible headache and struggled to breathe. My doctor rushed me to my OB's office, who took my blood pressure, which was 220 over 130 and climbing. I was then rushed to the ER. The specialist said that I was so full of fluid that I was mere hours away from the fluid filling my heart and killing me. In fact, they strapped me down to my bed to prevent injury from my inevitable seizures that would come. Fortunately, we caught it in time for the diuretics and BP medicines to work, and I left the hospital a few days later feeling fine and had no further complications. If this can happen to me, It can happen to anyone. I lived in a large, affluent suburb and received phenomenal prenatal care, including twice a week OB visits from 32 weeks on. At the time, my husband was in medical school and my father-in-law was a practicing physician. I was literally surrounded by family helping me with my girls and by medical professionals taking care of me. And yet somehow I missed all the symptoms of postpartum eclampsia until it was nearly too late. I naively assumed the swelling and discomfort were normal for mothers who had just delivered 7-pound twins. I didn't know it was eclampsia. I had never had a baby before. What if I didn't have a support system at home? What if no one took me seriously when I fell so ill? What if I was dismissed as a hysterical woman? What if I was a person of color instead of a red-headed white woman? What if, what if, what if? I am so grateful for the medical care I received. It allowed me to be here to raise these beautiful, precocious girls you see on the screen. And I hope that extending postpartum Medicaid coverage in our state will help many others who don't have the privilege that I have get the care and help they need. Thank you. I'm going to turn the time back to Eliza.
Previously, Medicaid after childbirth was only extended for about 2 months. It was that way since 1970, over 50 years. Expanding it to a year increased the time by 600%. Think about the lives that could be saved. Like I stated in my documentary, pregnancy-related deaths can happen up to a year after childbirth. In fact, a third of deaths happen 1 week to 1 year after delivery. So it only seems logical that Medicaid should be expanded to a year. That's what this bill will do. During my interview with Dr. Brumley, I asked what my generation can do to help maternal health. She responded, making sure we keep attention on this issue. We can't let it be forgotten. And that's how I will conclude. Maternal mortality is a major issue, of course, and it's outrageous that the rates are so high in the US. If we didn't have good medical coverage, my mother wouldn't even be here. And some are not so lucky. If we can do something about it, we should. And you don't even need to go to medical school to help. We cannot forget my generation of women, and the next, and the next. We need to ensure that our children can have children safely, because around now, it was way safer to have a baby 40 years ago than it is today. The fact is that maternal mortality rate is only getting higher, and we need to do something about it now to make a better world for the next generations. Thank you very much.
Thank you, Eliza, and your mom, Erin, for your advocacy and your support of babies and families.